When we use medications, we're trying to use them in a fashion that has been proven to be most effective. The medications that we call disease-modifying anti-rheumatic drugs tend to have a time in the body. It's what they call the kinetics, how long it takes to absorb it, how long it takes to get rid of it, and then how long the biological effect is. So some medications have to be taken quite frequently. A couple of times a day, once a day, every couple of days. Other medications can be taken less frequently, once a month, every 2 months, for instance. Most of them are taken more regularly, and when we take them that way, we can guarantee or predict that you will have benefit. So when you start taking the medication less frequently and a medication has a long biologic effect, then you'll have a sense that if I just missed it for a week because I was vacationing and I didn't want to take it, you say, it didn't make any difference. Then 3, 4, 6 weeks later, you have a flare, you say, can't be the medication. I stopped that a long time ago. So it's important, and we try and share that with our patients. Here is how this medication works. It takes 6 weeks to come on, it takes 6 weeks to come off. And so adjusting the medication may give you a false sense of security. When a person comes to me and says that they're taking their medication less frequently and they're doing well, I say, that's fantastic. You've just done a natural experiment. Let's take advantage of that experience, and maybe we can reduce the dose, reduce the burden, but because we're not confident that you will have that long-term benefit if you take it irregularly. So it's important to have a discussion, discreet, explicit, about what the expectations are for best outcomes. One of the things that really concern people when they get a diagnosis of rheumatoid arthritis, first, it's a chronic disease. We have no cure. It's a disease where the majority of people will be on medication for a long period of time. What really distresses them is when they get exposed to the medications, i.e. they're told they're going to be taking this and this and this, and it becomes complicated, and especially if there's other medications. So first question, will you need a medication? Yes. Will I be on a medication for the rest of my life? I'll say, in general, yes. 85% of people in our practice, my practice, will be on medications. About 10 or 15% are able to enter a medication-free remission. In terms of, are you going to be on the same medication? In general, in my practice, they are, because we seem to get good responses that way, but we're always testing the waters. We always give a chance, an opportunity for patients, when they're doing well, to discuss reducing the medication. I actually put that as part of the initial contract. We will review this. I know that you're not happy with this, but we will review this. So you can anticipate you will be on a medication. More than likely, you'll be on it for a long time. We will also guarantee that we will assess your need for that medication on an ongoing basis in a discussion with you. And we invite you to tell us when you're ready for that, if we have not engaged that conversation.